It's great to welcome back to the program Gerald Friedman, professor of economics at my undergraduate alma mater of the University of Massachusetts. Jerry, we've spoken before about your detailed analyses of the costs and benefits to a Medicare for all or other single payer type healthcare system in the United States. We now have Bernie Sanders's 2017 Medicare for all proposal. So what better time than now to actually talk about what such a system would cost? Now, you see the detractors of these systems say big tax increase, incredibly expensive. It's more promising of free stuff that's not really free. The counter to that would be that it would save much more money than it would cost. So top line, how do we start thinking about those numbers?
Okay, well, the first thing to do is to think about there are actually three different numbers. The first number is what a Medicare for all system would do for the entire US economy versus what we have now.
Mm-hmm.
Because of course there are big numbers involved. What we have now are big numbers. 18% of our gross domestic product, 18 cents of every dollar that we produce in this country goes for healthcare now. Our Medicare for all system would lower that. We would be able to get the same healthcare for less money. And this is a point on which I think there is almost no disagreement. Critics will admit that, yeah, it would save money on the current healthcare system. It's almost impossible to argue otherwise because Medicare is a more efficient bill payer than the current insurance systems, private health insurance. Medicare doesn't involve the type of marketing or profits that are involved in the current system. Medicare saves money for providers because it's easier for providers to bill a single system than to bill the dozens of insurance companies and hundreds of insurance plans in an average American state. To give you just one quick, easy example to show this, in Toronto General Hospital in Ontario, Canada, with a single payer system, there are two people who do billing in that hospital. Massachusetts General Hospital is about the same size, the same number of beds, more or less, same number of patients. There are 450 people who do billing there. I mean, so you go and save money.
Yeah. Now, what about there's an argument that part of the savings would be because if you have a single payer, they could force providers to just have to charge less, and thus it would significantly depress wages within the medical infrastructure for doctors and nurses. How do you respond to that?
Well, not particularly for doctors and nurses. Now, they would pay providers less because providers would have lower costs because of this the saving on the billing process. Mm-hmm. And there are some providers who currently are earning what economists call rents, which is a situation where you have a monopoly and you exploit everybody else. The biggest rents are in the pharmaceutical sector. You have this hepatitis C pill that sells a course of treatments costs $85,000 in the United States. It costs, no joke, $200 in India. So they are exploiting the rest of us. And the research for that, as for most drugs, is paid for in the first place by the National Institutes of Health and the National Science Foundation. So we already paid for this drug, and then we're paying again. So in my estimates for Medicare for all, you'd be saving large sums on bargaining effectively for drugs. And there are also some elite hospitals that would be facing cuts, but not that much. Medicare currently pays hospitals about 22% less than what hospitals get from private insurance companies. That's overall. Now, that is about my estimate. It's a little more than but it's close to my estimate of the administrative savings from single payer. So so the hospitals, some hospitals like Mass General would probably get a bit less because they are currently exploiting the rest of us to some extent. There's abundant evidence on this. But overall, hospitals would be awash, doctors would be awash. Doctors would actually benefit. Those doctors who currently treat Medicaid patients would get a raise. So overall, we would achieve savings of maybe $600 billion or so on our total healthcare spending. And those savings would largely come from being more efficient, doing the same stuff better.
So
Now,
along those lines, there was an analysis done of the proposal that Bernie Sanders had during the campaign, right? So this is not the most recent proposal, but from the one
yeah,
during his campaign. And it
yes,
estimated that the cost to people who are earning salaries, wage earners, would be about a 2.2% surcharge, which I estimated on someone earning $50,000 would be about $1,200 or $1,300 roughly. Can you
yeah.
talk a little bit about, in the analyses you've run, sort of what would be the costs to different parties?
Okay, well, there we get to the second and third questions. The first question is the total economy. The second question is the federal government. And yes, there would be a tax increase. That 2.2% was actually what Bernie was proposing last year, um, plus some payroll tax. There would be the federal government would be spending more and taxing more, but that would be replacing what we're already spending on taxes that go to private bodies. When we buy health insurance, it's mandated by the government. We have to buy health insurance, and we have to pay for health insurance premiums. To me and to the Supreme Court, that means it's a tax. It's just a tax collected by private agencies. Now, the third question is for the individuals. Who would be paying more, who would be paying less? Because we'll be paying less in public taxes to the government than in private taxes to health insurance companies, because the whole system will be more efficient. But there'll also be particular savings for some people, because in Bernie's proposal and in the proposals that I've written, we have an element of an income tax, or a tax related to how much money you have and how much you can afford to pay. Whereas now your health insurance premium is either a lump sum, everybody pays the same, or sick people or people in families with a sick family member pay more. So we put a tax on sickness, which is a double tax in effect, because if you're sick or you have a family member who's sick, your earning capacity goes down because you're spending time taking care of your family member, or that family member can't have a job because they have a disability, whatever. And then on top of that, you have to pay this extra health insurance because the health insurance figures out that you're sick, and they get you into a plan that covers sick people. I mean, they have to sell you insurance, and they can't charge you extra for pre-existing conditions, but they work it.
Well, that relates to this idea of everybody with pre-existing conditions under Trump Care versions 1, 2, and 3.0, all of which so far have failed, would have access to a plan regardless of pre-existing conditions. But that's very different than it being affordable, and it sounds like that's sort of what you're getting at.
Yes, what we already have is something in that direction, but there are real limits on it. Whereas what they were proposing, access, that's just I would use a word that you can't put on television or commercial television or radio. But access just means they have to offer you a plan. But they could offer it at $80,000, $150,000. I mean, and then, okay, you have access. You can buy it if you could afford it, and who could afford that?
And so you and I have been talking about a single payer system. And are you experiencing that there are people who are confused, understandably so, not as a criticism, between a single payer system, where the government would be the one payer, versus nationalizing healthcare, where the government runs and operates the hospitals and employs the doctors and nurses? Do you see as much confusion about that as I'm seeing?
Oh, yes, absolutely. And that confusion is promoted by critics who say we're going to have a government takeover of health insurance. No, we're going to have a government provision of health insurance for people. If you want to buy health insurance on your own, this isn't in Bernie's plan, but it's in a lot of the plans that I envision. then yeah, you could buy health insurance. Why somebody would do that, I don't know, because they would already be getting it through the government for free, in effect, because they'd already be paying the taxes. But there would not be a government takeover of the provision of healthcare. Britain has that.
Right.
And arguably, the healthcare system in the United Kingdom is the best in the world. Government provision of healthcare through the National Health Service is extraordinarily efficient and delivers very good care. But we're not talking about that. We're talking about something like Canada, where they have private provision of healthcare. Doctors work independently, hospitals are run independently, but there is government finance. So all the bills go to a government agency. If you go to a doctor in Canada, billing amounts to the following. You swipe a card through their machine. The doctor or the nurse types in the diagnostic code and the treatment code, and you're done. That's it. The government agency will send a check for your services to the doctor. The doctor deposits that check in her private bank account. All done. That's it.
Jerry, what is the best place for people to be able to check out your detailed proposals of how this would all work financially and economically?
Well, one place would be Physicians for National Health Plan, pnhp.org. My 2013 financing proposal is up there. And there's a wealth of good information there, top quality research on the Canadian healthcare system, foreign healthcare systems, issues in the United States healthcare system. There's some of my work is up there, and there's a lot of work by other excellent scholars. Also, another very good place for healthcare in general is the Kaiser Family Foundation, kff.org. And finally, the commonwealthfund.org. My most recent published work on single payer was from 2015 for New York. And that is, if you Google New York Health Plan, I don't remember the website.
Fair enough.
Yeah. All
right.
Also, you can always write to me.
Absolutely. Yes. And people, I'm sure, will find how to do that.
Yes.
We've been speaking with UMass Professor of Economics, Gerald Friedman. Always great to talk to you.
Absolutely. Thank you for having me.